In this episode of Ask Dr. Zach,
it's been more than 10 years since I have this abdominal pain. Sometimes it comes to my right, sometimes it comes to my left. Sometimes it really can be extreme.
and later,
I had a heart attack and I had no symptoms. My doctor used the stethoscope to check my heartbeat, and then he picked something up. He said this probably was a silent heart attack.
then on the doctor's orders,
Doctor's orders, consider an autopsy. It's not pleasant to think about, but if someone you know dies and you don't know why, consider an autopsy.
In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small.
Abdominal pain is something that affects all of us at some point, from minor indigestion to life-threatening infections or blockages. The severity of abdominal pain varies from mild to severe and doesn't always correspond to how serious the condition is. Often, severe abdominal pain brings people to the ER. To learn more, let's take a look at this amazing Blasen medical animation.
The abdomen is the part of the body located between the thorax and pelvis. The rectus abdominis muscles are a pair of vertical muscles near the midline of the abdomen. Transverse bands of collagen fibers can give definition to this muscle, otherwise known as abs or a six-pack.
And we'll have much more about abdominal pain after this.
up next,
It's been more than 10 years since I have this abdominal pain. Sometimes it comes to my right, sometimes it comes to my left. Sometimes it really can be extreme.
all this and more right after this short break.
It's been more than 10 years since I have this abdominal pain. Sometimes it comes to my right, sometimes it comes to my left. Sometimes it really can be extreme. So the body movement of left and right, which may affect my pain, which is now and then, but it comes only after usually raking for a few hours. It's like a dead pain. It's not that bad that I can't bear it, but it's still there. And then sometimes it's very difficult to get up from my bed. And when I move to your right and do something or do more life, so that's the main thing. But it's just maybe once in a year or maybe once. I don't know exactly how it comes. I've done more than 3 CAT scans and 2 colonoscopies and a lot of ultrasound too, but they can't find anything. They found some polyps, but they found it was benign. They gave me another 2 or 3 years to see, wait and see, and then go for another CAT scan or maybe another ultrasound. I do a lot of exercise, I do a lot of work, I do a lot of walking. I eat healthy, so I live healthy, so that's no problem. I told my wife, and she knows that I go to doctors. I have no other problems other than that. And I keep on doing my daily routine, going about my daily business. So it's been more than 10 years, it's come on and off. So I would like Dr. Zach just to let me know exactly what is happening or if he can figure out something for me.
Now it's time to ask Dr. Zach.
Welcome, Christopher.
Welcome, thank you.
Thank you for being here. So tell me, what have you been experiencing?
It's funny, but it is true. It's been nearly 6-7 years now since I've been getting pains on either side.
Okay.
And once it goes here, once it goes there, it stops, it goes. When I exercise, I lose it a bit.
And you said that exercise makes it better?
Yeah, it does.
That's
make it
interesting.
better.
And have you noticed what makes it worse? What brings it on?
Mostly if I do a lot of garden work, like when I move in one direction continuous, because that is raking the leaves.
So what kind of exercise makes it better?
Just regular walking, regular walking.
But when you're
exercise.
twisting more?
Yeah, the twisting part of it, or lifting some things.
Yeah. Is there anything associated? I mean, like any nausea, vomiting, diarrhea, anything like
So
that?
far, not that I know of, no.
Okay.
nothing.
And when does it come on? Can it come during the night as well?
Yeah, sometimes it's late evening, sometimes it's really acute. It's really acute pain, and then when I rest, take a rest for about maybe a day or two, I just relax and take it easy, and then it goes off again. And I took aspirin for a couple of times when I got it really bad.
Yeah.
But then they said, don't take aspirin, take Tylenol, which I took Tylenol for a few days.
Okay.
And it subsided a bit, but it didn't almost go off.
When you get it, how long does it last?
It continues for a day or two, maybe, sometimes 2 or 3 days, and then it goes off for 2 or 3 days.
Well, that's a long time. So constantly for a couple of days.
Yeah.
And you said it's not always in the same place.
No, it's just on either, sometimes on the right, sometimes on the left.
The other thing I was wondering about is about the activity, because it's always interesting what brings it on, you know, if you have a consistent thing that brings it on. Now, you mentioned twisting.
Either twisting, mostly twisting when I do raking of the leaves. And then the other thing is I've noticed is if I do a lot of lifting, lifting heavy stuff, which I stopped now much, so that's relaxed a bit.
That sounds a bit muscular.
That's what I thought, and then I'm taking cholesterol pills.
Oh yeah, yeah.
So I was getting pain in the knees and this thing, which I stopped for a few years.
Yeah.
And now they put me back on the cholesterol again.
Well, if you ever get diffuse muscle pains, severe diffuse muscle pains, then you really have to stop it. It's usually not, what you're describing doesn't sound like it's from the pill.
That's what I stopped it, and I'm feeling much better now, which I stopped about 2 months ago now.
Oh, you stopped, and you're feeling better with respect to the abdominal pain?
Yeah, a little much better.
Well, that's interesting. It certainly suggests there might be a correlation. And the other thing I was asking about is, nausea, vomiting, diarrhea, because that suggests that it would be in the intestinal tract, but you don't have any of those.
No, nothing of that.
Any urinary type symptoms?
So far, no. I'm pretty healthy in all other ways.
And the reason I was asking about the exercise is, if every time you exercise you got pain and it got better when you rested, that would suggest something to do with blood supply.
No.
But it's not the case for you.
No, not that I know of. Yeah. Every time I do I just do the life cycle and the walk, which is about 40 minutes.
Yeah.
And then it's no problem at all there.
And your energy level's good?
Excellent. I just read the 10K.
Oh, did you?
Yeah.
Oh, that's great.
With Sporting Life, yeah.
Oh, that's awesome.
1 hour, 25 minutes, yeah.
Let me ask you one other thing. Do you do any strengthening, like abdominal strengthening type exercises?
Not that I know of.
That might be worthwhile looking into.
My daughter is a physiotherapist, and she told me one exercise which I do quite often, and that helps me a lot.
Yeah.
It's just standing up and then trying to put your stomach forward and neck back, and I don't know what it helps in the abdomen, but it works quite well. Yeah,
well, the abdomen and the back, they're really connected. So strengthening one set of muscles often strengthens the other.
She said it might be the lower part of your spinal cord.
Yeah, could be.
So that because I had a few bad falls when I was maybe 8 or 10 years ago.
Oh yeah.
And there were really bad falls, which I really bruised the whole back area. So I don't know whether that is still affecting now.
It could be, absolutely.
So that's basically what I like.
And the fact that it's persistent, which is annoying, but the fact that it's not getting worse and you're not losing weight, you're not feeling tired.
No.
Those things all are, reassuring. And also you have had some testing done.
Yeah, I've done a lot of testing, a lot of doctors.
Yeah, exactly. Which, it can be annoying, but once you've done all those tests, it is reassuring.
Right.
It means they haven't found anything bad.
No, that's
usually something really bad we find pretty quickly.
That's
so
true.
They haven't found that.
No.
And I would continue with what you're doing. It sounds like you're better since you stopped the medication.
Right.
You're doing these exercises, which are helpful.
Which I always do.
And aside from that, keep an eye. I would continue, doing the strengthening of the abdominal and the back and what they call the core muscles. Very popular now.
Thank you. Yeah, that'll be great.
My pleasure. Any other questions?
Not really. That's the only bit of problem. That's the basic the pain which has been going on for nearly 8 to 10 years.
Yeah.
And I've been very active. So.
Well, keep it up. Let me know if it doesn't go away. Come back and we'll talk some more. Okay?
Definitely.
Now, Dr. Zach's prognosis.
Christopher has had abdominal pain for some time. Now, it's reassuring the fact that he's had it for this long and he hasn't been losing weight, he doesn't have pain that wakes him at night, he doesn't feel generally terrible. Also, he's had a lot of tests done, which is a good idea to make sure, but it looks like they've ruled out the serious things. Now, it seems to be a muscular problem, and for that reason, he's working with his daughter, who happens to be a physiotherapist, to increase the strength and flexibility of his core muscles. I think that's going to help him a lot, and if it doesn't, he needs to follow up with his doctor.
Still ahead.
I had a heart attack and I had no symptoms. My doctor used the stethoscope to check my heartbeat, and then he picked something up. He said it probably was a silent heart attack.
Or you go back and do it this way.
I had a heart attack and I had no symptoms. My doctor used the stethoscope to check my heartbeat, and then he picked something up. So I had 5 or 6 or 7 tests, ended up at a cardiologist, and that's when he picked up that I had had a heart attack. And I said, well, why wouldn't I have some symptoms, pains or numbness or something? And he said, not necessarily. And he said, probably was a silent heart attack. I've been extremely active since I was a toddler. I loved to run and swim and do what the boys do because girl stuff was too boring. And I haven't stopped. I visit my friends and I walk a lot. I do yoga 3 times a week. And then I work with 5-pound weights for the upper body.
Or you can do it this way. This way.
Don't do anything strenuous anymore. I used to do cardio and I'm afraid to do that. So I'm asking Dr. Zach, is the silent heart attack a precursor to the big event? Do you have just one or do I have heart disease?
Now it's time to ask Dr. Zach.
Welcome, Irene.
Thank you.
Thank you very much for being here.
Oh, you're welcome.
So, please tell me what you've been feeling.
I don't have any symptoms, but I did have a silent heart attack.
Oh, okay.
14 years ago, and 3 or 4 follow-ups, and the doctor told me, cardiologist, that if I didn't have any symptoms, I didn't have to come back.
Okay.
And then I did have another ECG with a subsequent doctor, and he said, my heart is normal.
Oh, that's good.
And I asked him, I said, does the heart heal itself?
Right.
And he just went.
That's always reassuring.
Yeah, I don't know what to make of that. But I do have some trepidation. I don't sprint for a bus.
Okay.
I don't make my heart race because psychologically I feel that was a precursor to heart disease.
Actually, silent heart attacks or silent ischemia is not uncommon. Sometimes people don't have symptoms, especially some people. It tends to be as we get older. It's more likely if we have high blood pressure, diabetes. There's a number of things that make it more likely. Now, if it's real, so usually, and I mean, the important thing is you do need to see a cardiologist because usually they'll do other tests to see if you do have some damage. Like, did they ever do an ultrasound?
I had a series of tests, but he said that women have different symptoms. So he took the first one with me on my back, and then he had flipped me over and took it from the back.
That was it the electrocardiogram, or was it another test?
Yeah, and he said to me, he called me and he says, you've had a heart attack.
Right, okay.
And then I have some scar tissue at the bottom of my heart at the back.
Yeah. If there is evidence of heart damage and silent heart attack, silent ischemia, then unfortunately that's real damage, and then it does increase your risk of subsequent events and heart attacks and that sort of thing. So you have to be very careful. Yeah. However, the confusing part is then you were told that your heart is fine.
Yeah.
You know, if the heart doesn't remodel much. It can learn to sort of live with a bit of damage, but an area of heart that was actually sort of infarcted, what we call infarcted, so an area of the heart that actually died from lack of blood supply, that doesn't start to work again, but it can find a way to still be effective.
Yeah.
But I have to say it is strange. So that's why the other tests are important. So the other tests can show, and I'll bring the heart up here.
Okay.
The other tests, like the ultrasound or the nuclear medicine scan, can show whether a piece of the heart has been damaged. Like,
Yeah, he said at the back, at the bottom.
okay, so the bottom is here. So this is the front
Yeah.
of the heart. This is the bottom, and,
at the back.
and this is the back. Yeah.
Yeah.
And sometimes actually the electrocardiogram, if we do an electrocardiogram, we have to do an electrocardiogram in back to see if there's been damage in back. So that explains why he did that
why he
back
flipped me over,
electrocardiogram.
yeah.
You know, so and when's the last time you had a follow-up with the cardiologist?
5 years ago.
5 years ago. You know, the only thing I would want to know, or maybe your family doctor can just get all the notes because you want a final conclusion as to whether or not you've had any damage to your heart. If you have, then there are treatments to decrease your risk. In general, you still want to do the same things, right? Eat healthy, be active,
Yeah.
Don't smoke,
Yeah.
those sorts of things.
Yeah.
And don't be afraid to get your heart rate up, though. Honestly, you should be able to. I would start slow, but if you want to, I would start slow and increase it, sequentially.
Yeah.
If you ever feel unwell or whatnot, then you have to stop. Or pull back. But it is good, you know. The heart is a muscle.
Yeah.
And so you
Have
do want to work it out.
Yeah.
Absolutely, absolutely.
Oh, okay.
So we are out of time, unfortunately. It's been a pleasure talking to you.
It was nice talking to you.
Thank you.
Now, Dr. Zach's prognosis.
Irene was told that she's had a silent heart attack. That means she had a heart attack even though she didn't have any symptoms of it. Now that's possible, and it's actually pretty common. The important thing is to see a heart doctor, a cardiologist, and get testing done to see how much damage is done and see how to decrease your risk of having any more damage to your heart.
Don't go far. We'll be right back with the doctor's orders.
Doctor's orders, consider an autopsy. It's not pleasant to think about, but if someone you know dies and you don't know why, consider an autopsy. Now, some autopsies are automatic if it's unexplained or if it's a potentially criminal matter. However, an autopsy is only done if the family agrees to it in other cases. So consider it if you're not sure what happened. And also consider donating your organs when you die. You could save a life or several.
Now, it's time for you to ask Dr. Zach.
And now's the time on the show when we take some questions from the audience. So first question, please.
My name is Emily. I'm an analyst. So I have a question about what I call office fatigue. So I sit in front of a computer all day long. And when I get out of the building, I was like, oh, the sun is really strong and it's hurting my eyes, it's hurting my head. And then on the way back, I was just like, I have no energy to do anything else. Then when I go back, I sit down on the couch and watch TV, do something in front of a computer again.
Yeah.
Now, the middle of the night when I'm supposed to go sleep because of the blue light from the screen, I'm actually like hypered, so I can't fall asleep. So it's like a vicious cycle.
Yeah.
I don't know if you have any advice on how do we break that cycle.
As much as possible, do take breaks, and when you take breaks, get up and move around. Even if it's just once an hour, if you can, even just for just a few minutes. And it's ideally try and get some fresh air when you do. And the other thing is for when you're not working, push yourself to be active. You have to have some physical activity. So for example, if you can bike to work, or when you're at work, use the stairs, as opposed to driving in, that'll be helpful just because you don't have to think about it. You don't have to make an extra trip to the gym sort of thing. If you can, have smaller meals, less fatty meals at noon, and have even just snack during the day. That's another way that you can help kind of combat this. And over time, if you get used to that kind of lifestyle, you'll find that it will help you quite a bit.
That's very helpful. Thank you.
Good, thanks. Great question. Next question, please.
Hi, Dr. Zach. My name is John. I'm a freelance writer, researcher. I'd like to ask you a question on behalf of my aunt. She lives in Quebec. She's an elderly woman, but she's giving palliative care to a friend of hers who's an even older woman. She's 83 years old and has recently been diagnosed with lung cancer. Right now, they're both discussing issues about end of life, such as doctor-assisted suicide. I was wondering, do you have any information about what the prevailing attitudes are about this in Quebec at this time?
Yeah. Like in other places, there are a lot of checks and balances, which is the most important thing, right? Like, I don't want to forget any, but certainly things like the person has to be an adult, there has to be a couple of witnesses, there has to be a couple of doctors who agree that this is a terminal kind of illness, they have intolerable pain, and they're of sound mind, you know, they're not just depressed and want to die. So, and they have to maintain that for a little while, so it's not just one day they feel like they may want to die. It's not going to be every doctor who does it. So some doctors may say, I don't agree with this, or I'm not going to do this. A lot of palliative care doctors, for example, would not feel comfortable doing it. And part of the controversy also is palliative care doctors say, well, if people had proper care, if everyone had the palliative care, the pain control that they needed, maybe they wouldn't want to die. So that's part of the controversy. It looks like it's going to become law. And the doctors, even if doctor doesn't want to do it, we have to accept the fact that it's the law and refer someone on for more information. And I think it's good, though, to have an open discussion about it. And so if your aunt and her friend, I think they should go into a doctor and have an open discussion about it and what the law is, first of all, and whether or not that's an option they actually want to consider, or whether really the pain can be properly controlled, at least at the time being. But at least to know their options for the future.
Thank you, Dr. Zach.
Thanks. And now we have time for one last question. So last question, please.
Hello, I'm Misty. I'm a former dental assistant, and I'm curious if there are ways to figure out if somebody is a hypochondriac or if they're in the running for the Guinness Book of Records with the most amount of medical conditions.
There are some people who really suffer from hypochondria, but basically they're just very anxious and they go very frequently to the doctor. I mean, I guess one of the pieces of evidence would be if you go very, very frequently to the doctor, they're doing lots and lots of tests, they never find anything wrong, and they always reassure you to that end. And also if they start saying, do you think maybe this may have an origin in anxiety? Are you very stressed out? Is it brought on when you're lying in bed quietly and thinking of all the stress in your life? Well, if it is, then that is a clue. It doesn't necessarily rule other stuff out, but it is a clue that it may be a stress-related illness. Now, as to the Guinness Book of World Records, I don't know. I wouldn't be surprised if people had applied.
Had to put a joke in with it,
Absolutely.
just
Thank
in
you.
case, But
For
thank
sure.
you. I appreciate your help.
Thanks. And that is all the time that we have for today. And I want to thank our great studio audience for some great questions and hopefully some very good answers as well. Be sure to join us next time on Ask Dr. Zach.